Welcome to The Explainer. Today, we are diving into the science behind something that could be a real lifeline for cancer patients, cannabis. So can it really help manage that relentless nausea from chemotherapy when all the standard treatments fail? We've dug into the research to find out. Okay, so here's the game plan. We'll start with the huge challenge of chemo-induced nausea. Then we'll get into the biology of how nausea actually works. After that, we'll look at the standard treatments, the cannabinoid alternative, what the clinical trials say, and finally, we'll weigh all the risks and recommendations. Let's begin with the problem itself. It's called CINV, or chemotherapy-induced nausea and vomiting. And for so many patients, this isn't just some side effect, it's this relentless battle that can feel just as difficult as the cancer treatment itself. Now, just let that number sink in for a second. 1/3. Even when doctors use the very best, most advanced anti-nausea drugs we have, a full third of patients on strong chemotherapy still suffer from significant, uncontrolled nausea. This isn't some rare thing. It's a huge gap in modern cancer care. And look, we're not just talking about feeling a bit queasy. Uncontrolled CINV absolutely devastates a patient's quality of life. It can mean more hospital visits, and in the most serious cases, it can actually force a patient to stop their life-saving chemotherapy. So, to figure out how to fight this, we've got to understand why it's even happening. What's going on inside the brain? Well, you can think of nausea as your body's alarm system. The problem is, chemotherapy can make that alarm just go haywire. Deep down in your brainstem, there's this little region called the chemoreceptor trigger zone, or CTZ. And its whole job is to be like a tiny security checkpoint, constantly scanning your blood for anything that seems toxic or dangerous. And this kicks off a super fast chain reaction. The CTZ spots the chemo drugs and immediately flags them as a threat. That triggers a flood of chemicals, like serotonin, which send this urgent alarm signal to the brain's vomiting center. And that center just flips a switch, causing that intense feeling of nausea and the reflex to vomit. Okay, so to break this chain, modern medicine has developed a whole arsenal of drugs. But as you'll see, even our best tools have some pretty big blind spots. So our current strategy is all about targeting this cascade head-on. We have drugs that block that serotonin signal and others that block a totally different pathway. And they're often fantastic at stopping the physical act of vomiting. The big problem? They're often way better at stopping vomiting than they are at dealing with that awful, constant, underlying feeling of being nauseous. Plus, they come with their own risks like heart rhythm issues or bad interactions with other drugs. And that gap, that's exactly where this controversial challenger comes into play: cannabinoids. And while it might feel brand new, the use of cannabis in medicine actually has this fascinating history that goes back thousands of years. And wow, what a roller coaster it's been. I mean, you've got records of it being used for pain way back in ancient China. It was even found buried with a Siberian mummy who had breast cancer. But then, in the 20th century, it was outlawed, only to pop back up in the 80s when a synthetic version of THC got approved for this exact purpose, fighting CINV. And of course, the whole wave of medical legalization since then has brought it roaring back into the spotlight for serious research. But here's where things get really interesting and kind of tricky. There's this paradox with cannabis called the biphasic effect. It's a true double-edged sword. In low, controlled doses, it can be a fantastic anti-nausea tool. But in high doses, it can actually cause the very nausea and vomiting it's supposed to prevent. Which means, you guessed it, getting the dose exactly right is everything. All right, so this brings us to the main event. What does the hard evidence actually say? Let's look at how cannabis did in these tough clinical trials for refractory CINV. And by that we mean for patients where the standard drugs just didn't work. The data from a big Australian trial, it's pretty stunning. A complete response meant no vomiting and no need for any rescue medications. Well, the group that took a balanced THC and CBD oil had a response rate of almost 25%. Now compare that to the placebo group, which was just 8%. So you were basically 3 times more likely to get complete relief with the cannabis treatment. That is huge. And I really want to drive this point home. Remember who these patients were. This wasn't their first try.
These were the absolute toughest to treat cases, people for whom the best, officially recommended drugs had already failed them.
But honestly, this next number might be the most telling stat of all. After the trial was over, the researchers asked the patients which treatment they would rather keep using. The answer was just overwhelming. A whopping 83% chose to stick with the cannabis treatment. I mean, that just speaks volumes, right? That tells you what their real-world experience was like.
Okay, but let's be real. Efficacy is only half the picture. We have to get a balanced view, and that means we have to talk about the risks. This is not a magic bullet, and it's so important that we understand the potential downside.
The most common side effects are probably what you'd guess. Feeling sedated, a little dizzy, maybe some disorientation or dry mouth. For most patients in the trials, these were pretty mild and totally manageable. And the key thing is, they were dose-dependent, which means they could often be handled just by tweaking the dosage. But there is a more serious and pretty strange risk, and it brings us right back to that double-edged sword we talked about. It's a condition called cannabinoid hyperesis syndrome, or CHS. And this is where long-term, high-dose use can lead to these severe, recurring cycles of vomiting. And right now, the only known cure is to stop using cannabis altogether.
So, where does this leave us? What's the bottom line from the experts? Well, after looking at all the evidence, the American Society of Clinical Oncology concluded that for these really difficult, refractory cases of CINV, adding cannabinoids to a patient's normal treatment plan may improve their outcome.
But, and this is a big but, you have to read the fine print here. This is called a weak recommendation based on evidence with moderate to low certainty. Now, that doesn't mean it doesn't work. It's just the scientific community's way of being cautious. They're basically saying, hey, this looks really, really promising, but we need more top-notch research to be 100% certain. And that leaves us with the big question, doesn't it? Are we looking at the dawn of a new, precision tool that we can use to help the patients that nothing else helps? Or is this a super complex solution where we're just scratching the surface of the risks? For now, the evidence is promising, but the final verdict is definitely still being written. The science continues.